The epitome of homeopathic philosophy. Homeopathic philosophy may be divided into three sessions: the theoretical, dealing with how and why remedies act, why is so abstruse that it can be best be dealt with by the more advanced student; the didactic, meaning the rules and the tenets; and the practical, which comprises the art of applying the rules in prescribing for the actual patient, understanding results, and following through the subsequent prescription to cure. First, let us take a bird's eye view on the didactic aspect. Health, to a homeopath, is a state of harmony between the parts of the body and also between the person as a whole and the cosmos. In real health, the as yet unexplained life force in which each person is vigorous. It is usually spoken as of the vital force, which in disease is the true curative power. The object of giving the similar remedy is to stimulate the vital force. The object of hygiene and mechanical intervention is to clear its path of obstructions. No remedy can cure disease. It can only be best enable the vital force to function properly again. Disease, to a homeopath, is a state of disharmony involving at least three different factors: some morbid influence, the susceptibility of the person affected, and the individuality of the patient modifying the form of the disease takes. Homeopaths do not try to cure the morbific influence but to cure the patient himself. In order to cure the patient, the most similar remedy must be given. Symptoms, to a homeopath, are the language of the body expressing its disharmony and calling for the similar remedy. For prescribing, one must take the totality of the symptoms, which includes the mental symptoms, the generals, predicated of the patient as a whole, which include his reaction to the etiological conditions, time, bodily function, food, etc. The particulars predicted of any part of the patient and the modalities of this, that is, what aggravates or ameliorates, and especially such particulars are rare, strange, and peculiar. The causative factors such as ailments from grief, wetting, riding in a cold wind, suppression of menses, etc., and the pathological symptoms, indicating the elective affinity of a remedy for certain tissues or organs. Homeopathy regards acute disease as an eliminative explosion, which, if handled in a proper homeopathic manners, leave the body in a healthier condition. This does not mean that the acute disease should be allowed to run its course, for if the symptoms are met at its inception by the simillimum, the disease will be aborted and yet the economy will be purified. No acute case under a homeopathic treatment from the beginning should die, and there should be no permanent sequel. Acute epidemic disease often run to one or two epidemic remedies, which vary as the disease shifts geographically. In this connection, the epidemic remedy is an admirable prophylactic, although the chronic constitutional remedy is always the best preventative. Sequel following acute diseases are not strictly speaking part of the acute trouble, but are the flare up of the chronic disease arose by an acute condition. Chronic disease is not a self-limited and show no tendency to ultimate recovery if untreated. This is the unique sphere of homeopathy. Practically everyone has some symptoms of the latent chronic disease, and to the homeopath, chronic disease is the basic of susceptibility. By taking the totality of the symptom from birth on, a deep chronic constitutional remedy can be chosen which will aid in the fending off future acute disease and remove many inherited and acquired encumbrance of the vital force. Hahnemann divided chronic disease into three main categories or miasms: sora, syphilis, and psychosis. These may appear singly or in combination with each other, or with drug disease and grafted by improper treatment. This matter of the miasm is the most difficult and most questioned in homeopathy, but the fundamental thesis of the importance of chronic disease in general is essential. Having prescribed for chronic disease, if you have given the true simillimum, the symptoms are cured in accordance with Hering's three law of direction: from within outward, from above downward, and in the reverse order of their appearance. This is never the case in chronic disease untreated by homeopathy, and therefore, when observed, one can be sure that it is the remedy which is curing and that the correct remedy has been found. Herring's law are so important that we will give an example. A rheumatic fever case where the joint symptoms have disappeared and the heart is affected receives the simillimum. Now the heart improves. Pain in the shoulder and the elbow, this disappear, and the knee and ankle are involved. This in turn pass off and the patient entirely recovers. The symptom went from within outward, that is heart to joints, from above downward, that is shoulders to the knees, and in reverse order of their appearance, that is heart to limbs instead of limbs to heart. If the symptoms do not go in this order, the remedy is wrong. When a patient on a chronic remedy develops a different symptom, search back in your record and question your patient rigorously to determine whether this is the recurrence of an old symptom, indeed a good sign, in which case no further needs a remedy. If it is not an old symptom, search the pathogenesis of the remedy given. If the symptom appear in the proving, give nothing. If not, the choice of the remedy must be revised. This law of cure may or may not apply in acute disease. Usually they don't. If the picture of the chronic disease includes a suppression, especially if the suppression is due to crude drugging, the chronic remedy acting according to the third law of cure will sometime restore the original discharge or eruption. The percentage of cases in which this return is from the original channel is relatively low. With good prescribing, however, some exurtoriation takes place, even though this may only be a diarrhea or a coryza. One of the many times when any practitioner most needs a thorough knowledge of homeopathic philosophy is when, after a chronic prescribing, he is faced with such a discharge having more or less acute symptoms. He must then decide whether this is a return of an old trouble in its original form, or a compensatory event, or a new acute disturbance, or an aggravation. If it is the first, he should wait and give placebo, explaining the process to sustain the patient's morale. If it is the second, he should attempt to do the same. If, on the other hand, it is a third, or the second is too annoying to a patient or even dangerous, one should prescribe an acute remedy and give it in low potency, 13th or even 12th, surely not above the 200. After this, the action of the chronic may not even have been disturbed. Often, the acute remedy called for will be found among the acute complements of the chronic remedy. If in the fourth case, the disturbance is merely an increase in the number of patients complained, or is found under the pathogenesis of the chronic remedy given, it can be classified as an aggravation and should receive no medicine except placebo, unless dangerous as above. If it is so serious as to threaten life, owing to the chronic having been given in too high a potency, an antidote may be in order. The selection of the antidote will be taken up in the later lectures. The great point is to not mix up your case and spoil it by giving an unnecessary remedies. In addition to acute and chronic disease, there are, of course, diseases due to drugging or bad hygiene, and there are diseases which have ultimately themselves in pathology calling for surgery, and also troubles which are primarily surgical, like foreign bodies, fractures, extrauterine pregnancy, etc. A word should be said here about pathology and surgery. From the homeopathic standpoint, much of the pathology is protective. Abscesses, ulcers, tumors are an effort on the part of the vital force at localization and extrusion. Such pathology should not be removed by surgery until after the sick constitution which produced such pathology has been cured. Often, in the course of the cure of the pathology, will shrink or be absorbed. If not, it remains a foreign body and is a subject for surgery. Its removal before the cure of the constitution simply means that, balked at that outlet, the vital force will seek another one, either by recurrence in the same form or by more deep seated trouble. As to surgery, some of the orthodox homeopaths hold that any surgery that is not merely a mechanical adjustment, such as ventral suspension of the uterus, is a definite bar to cure. The idea being that in the unraveling of the disease it gets back to where the knot was cut by the surgery and can go no further. It requires the keenest judgment to decide when a case has gone too far to be relieved by medicines and emergency surgery is indicated in the crisis. The homeopathic medicines should always be resumed after the surgery. In any of these classes of disease where they have been wrongly treated, one should include the symptoms of the patient before the incorrect treatment, in other words, original symptoms, in the totality. Having glimpsed the didactic aspect, we must return over the practical philosophy. The unique law which is the basis of all homeopathy is similia similibus curantur. How we arrive at this equation, the actual studying of the drugs and the patient, is the province of later lectures. The actual handling of a case after the first remedy has been selected is the most difficult part of homeopathy. First is necessary of giving a single remedy. This includes the use of compound tablets, alteration of remedies, and homeopathic adjuvants such as cantharis and anodynes, etc. In a case where the miasms are mixed, it may be impossible to cover the totality of the symptom with one remedy. In such a case, observe which miasm is, so to speak, on top and prescribe for the totality of the symptom for that miasm. And when these symptoms are cleared off, the layer beneath, representing perhaps another miasm, may be prescribed for again by a single remedy. Sometimes the remedy indicated may be one which has the power over all the miasm, as for instance nitric acid. The single remedy does not mean that only one remedy should be used throughout a case, although that is desideratum, but simply one remedy at a time. It cannot be too often stated that one must not give a remedy lightly nor change it frequently. In acute diseases, the single remedy at a time still holds, although the remedy may have to be changed as the case develops. In which case, some of our master prescribers hold that the original remedy may be indicated again at the close of the cycle to complete the case. Further details on the single remedy will come up in the lecture of prescribing. Next, in importance to the selection of the single similar remedy is the question of dosage. The classic rule is the minimum dose. We prefer the term optimum potency, meaning the potency on the plane most similar to that of the patient at the moment in question. Hahnemann's original choice of the word minimum served two purposes. First, to discourage the enormous crude drugging of his time, and secondly, to point out that the high potencies have a different action from crude drugs. The whole potency question will be discussed in the later lecture in full. The question of repeating the dose is the next in importance. As a simple rule for beginner, high potencies should be given in one dose with placebo. The low potency 30th and under may require repetition. After giving the single dose of the single similar remedy, the student must wait and watch. The duration of action of the remedies and the factors influencing it will be discussed in later chapters. The general rule is to give nothing more than placebo while improvement continues. In other words, as long as the patient himself feels increasingly better, regardless of the accentuation of certain symptoms. The beginner must learn not to try to make a good thing better by repetition, as this defeats itself. According to the case, the potency, and the remedy, the need of repetition may occur in from a few hours in acute disease or a few minutes in desperate cases, to weeks, months, and even a year or more in chronic cases. Although waiting is perhaps the most difficult lesson for the eager homeopath. He must wait with knowledge or valuable time will be wasted. How is he to know whether the remedy is the right one or is still acting? In acute cases, the general well being of the patient should be apparent in from a few moments to 3 or 4 days. In chronic cases, it varies from a few hours to a several weeks. Sometimes, indeed, it is only apparent after the second dose. In chronic cases, Herring's law of cure, mentioned earlier in the paper, will show you whether you are on the right track. It is at this point, while watching the action of your remedy, that you must understand the subject of homeopathic aggravations. And aggravation is not necessarily to improve, but it often occurs even with master prescribers. The usual cause of severe aggravation is an error in the potency or the presence of marked pathology. Aggravations are of two kinds: disease aggravation and remedy aggravation. The first of these is merely the natural process of the disease and does not concern us here. The second, or the remedy aggravation, which is a sort of house cleaning, is indicative of the prognosis of the case and has about 12 recognizable forms, which we will be discussing later. Due allowance for aggravation must be made before considering repetition of the dose. A general rule is that even during aggravation, patient as a whole in himself feels better. The subject of the second subsequent prescriptions, one of the most important in the subject homeopathic philosophy, will be better understood in connection with prescription later on. Another very vital point in the homeopathic philosophy is that of suppressions. The causation of suppressions are dependent on so many factors. The results of suppression, untreated, so dire and frequently unrecognized, and the results treated so brilliant that a complete lecture will be devoted to this subject. To present homeopathic philosophy lucidly and logically to a naive is highly impossible. The student is urged to read and reread the appended list of books. Reading list: Lectures on Homeopathic Philosophy by James Tyler Kent, The Genius of Homeopathy by Stuart Close, A Synopsis of Homeopathic Philosophy by Gibson Miller, The Organon by Samuel Hahnemann, Homeopathy: The Science of Therapeutics by Carol Dunham, Manual of Pharmacodynamics by Richard Hughes. Thank you.